My name is Rebecca Graham. I have been working in healthcare for almost 40 years, and I have worked predominantly within South Australia in the public health system. I've worked for many years in mental health services, which was thoroughly enjoyable. I also have worked in association with country services for at least 13 years, which has been the very best part of my career.
Hello, I'm Tanya Lehman, and I'm an organisational change leadership coach and consultant. Prior to that, I spent 25 years working in the public health system, vast majority of that in South Australia, and all of it in rural areas.
When we became a new organisation in 2019, the 1st of July, we had a number of challenges as a new local health network. So we became a legal entity in our own right, and also at the same time of this governance reform program, the concept of governing boards were introduced. So some of the team were from an older structure, and some of the team were new appointments coming from a variety of different places. And then, of course, we had barely got our feet under the table when we headed into the summer of 2019-2020. And for our patch, it was a devastating bushfire season. So naturally, within the number of health services, we operate 10 hospitals across our patch and a huge number of community services, along with mental health. We had to respond naturally to the events as they unfolded. And that was extremely traumatic for ourselves. And so barely had we stood down. In fact, we were still in emergency management mode and still had an incident management team meeting. We were then hit by COVID. And I think while some of those things galvanised us as a team, we also were observing significant levels of burnout over a longer period of time and significant levels of stress within our team. The one thing that I am so delighted with was the fact that we continued to invest in our culture and leadership program, because what that enabled us to do was really to be able to lean in very safely with trust and to be able to lean in with discomfort. And that had been really important to forge those really strong, necessary relationships as a leadership team, and to create that ripple effect, that positive ripple effect throughout our organisation.
I had been working with the Leadership Circle profile for a few years, and so I knew how powerful it could be as an individual leadership development catalyst, and the collective leadership assessment, how useful that could be in helping a team of leaders see their collective impact. What was clear to me was, in order for this new entity to establish itself, common language was going to be really important to bring a diverse group of people together and form a team, but not just for the executive, also for the board. The Leadership Circle offered a tool that could help leaders to see what they needed to notice about the way they were showing up individually for themselves, but also how they're bouncing off their peers and their direct reports and the board, and to be able to have language to navigate through that, particularly when they're showing up in ways that were reactive to the incredibly challenging context they were operating in, and perhaps not the fullest expression of their leadership capability.
The idea of doing this as a collective, and that was to understand how we are seen by others, becomes a really critical point as a collective. And so to be able to do that, and I love the Leadership Circle because it's simple and it's visual. So and having used it and had confidence with it over a period of time, it became a really great tool. So it was an important piece of work that gave us some real evidence about where we were as a team and an organisation, but more importantly, it fed into the other initiatives that we were doing. So it fed into the way that we were using our Growing Leaders program. It fed directly into our executive coaching for us as an executive together and individually. And it fed into some of the work that we were doing around a deliberately developmental organisational team.
We designed a program that had the leadership circle at the heart of it, but that had many components to it. And so we had the collective leadership assessment that we did in October 2019 and again in November 2022. Once we conducted the collective leadership assessment, then every executive member did their own leadership circle profile. And as there was a little bit of turnover in the executive over that 3-year period, anyone new to the team was offered the profile and did the profile. And so there was a continuous investment in ensuring that everyone in the leadership team had been profiled. Had all of the executive and then 42 senior managers, so many of the direct reports of the executive team also had a leadership circle profile in 2019-2020, and then we added another 15 the following year. So a huge investment in leadership circle profiles at the executive and senior manager and even some team leader level across the organisation in that period.
When I watched the way we managed all of the bushfires and the recovery, we went into COVID, we set up a COVID hospital, we set up vaccination clinics, we set up testing clinics, we changed the services we provided, we swapped out to virtual services, we changed everything. And in that time, we went from what I observed people with superhuman effort after prolonged fatigue, we saw burnout. And as a CEO, that was extremely hard. At the time, you think you don't have a minute to pause was the time that we really needed to. So to be able to have our culture and leadership program run alongside us and to catch us, if you like, when we were falling was extremely important. And I continue to look back, that was the key, most important decision I made during that period of time. The culture and leadership program, if we had not had that in place during the last 4 years, I think I would have seen a much more serious impact on our team. I think I would have lost more members of my team, and that would have had an overall impact on our performance without a doubt, and our capacity to adapt and adopt to our external environment. So throughout this whole period, we have retained a very high performance rating with the department for this state. We constantly lean in and assist metropolitan services and have made a huge difference in that, which is now well recognised. So not only did we look after ourselves, we've looked after others. We did more COVID testing than any other local health network, and we had our community 80% vaccinated first beyond any other local health network. We have got a reputation for delivering. We have got a reputation of having a good culture, which is fantastic to hear back. I hear a lot people saying there's something going on in BHF, we don't know what it is, but it looks really good and everybody wants to work there. Even the Minister for Health says to me, everyone wants to work in BHF. But, we just had accreditation where we had 14 assessors come and review Barossa Hills Fleurieu over 5 days. And the feedback that we got from that accreditation around the dedication of our staff to their communities, about seeing our values in action, and about seeing our investment in culture and leadership. I couldn't have crafted a better response than they fed back to us at the end of their survey week. So I'll never know what would have happened if we didn't invest in this. And the support that we did with the program was on the run support, on the field support. So when things got really difficult, I had Tanya on the end of the phone, then with the individual coaching, then with the individual programs that we were developing and the middle management support that we were doing, together with our first mental health first aid work. And if we didn't have the capacity through this program to hear what was going on, to know how people were feeling, to be able to receive ideas and information about how to support people better, if we weren't open to that and didn't have a mechanism, I would doubt that we would have retained all of our leaders as we have done very well in, and that we would continue to be performing and seen as being performing so well. We can hold difficult conversations and still retain the relationships, the trust and the respect. That's, to me, one of the best signs of knowing that the program has been successful.
To see significant shifts, and still significant shifts in executive, but by and large, blow it out of the park improvements in the exec and direct report space, and a little bit more conservative recognition of their own progress. It's mind-blowing given those challenges of the constraint, the time of bushfires, COVID, change of government, massive pressure, resource constraint, budget pressures, that as a network BHF continue to outperform, achieve incredible performance and support and nourish their people.